And so we're going to start with Dr. Fatema Malbari. And please, Fatema, come up. Fatema is an assistant professor in neurology and in pediatrics. By the way, welcome to all of the pediatric neurologists who are here. We're so glad to have you with us. She's director of the Neurocutaneous clinic at Montefiore, and she's going to begin by telling us what the presence of tuberous sclerosis is at Montefiore, and then lead us into the second talk as well. Fatema, welcome.
Good morning, everyone. Thank you, Dr. Walkley, for that wonderful introduction and for allowing me to speak at such a wonderful event. So today I'm going to be talking about the Neurocutaneous Center at Montefiore, but before I do that, I did want to go over briefly tuberous sclerosis. As we all are aware, it is an autosomal dominant condition which affects 1 in 6,000 live births, and in the U.S., there is a reported incidence of about 50,000 people with TS. Although this is a genetic condition, we know that about 2/3 of patients do not have a family history of TS and present with a de novo mutation. The two mutations that are involved in this particular condition involve TSC1, which is on chromosome 9 and it encodes a protein called hamartin, and TSC2, found on chromosome 16, which encodes a protein called tuberin. That complex, the hamartin-tuberin complex, is a tumor suppressor complex that negatively regulates a pathway called the mTOR pathway, or the mammalian target of rapamycin pathway, which is responsible for cell cycle progression. I'm not going to go into that pathway in further detail because I believe Dr. Carino is going to be speaking about that a little bit later. So the phenotype is highly variable. Patients can have non-malignant tumors in multiple different organs involving the brain, the eyes, the heart, kidney, skin, and lungs. CNS manifestations include seizures, cognitive impairment, autism, neuropsychiatric disorders. And again, I'm not going to be going into that in further detail because I believe our guest speakers will also be talking about some of these issues. Other organ involvement include gums, teeth, bones, liver, pancreas, and reproductive organs. Skin manifestations include, there are multiple different skin manifestations. I've shown 4 of them. And about 80 to 90% of all patients with TS have at least one of these skin manifestations. So on the far left is a picture of a facial angiofibroma, which can sometimes be mistaken for acne in an otherwise asymptomatic child with TS or who has a milder phenotype. The second image is one of a shagreen patch. The third is a hypomelanotic macules. And to be part of the clinical diagnostic criteria, you need to have at least 3 of these measuring greater than 5 millimeters in diameter. And then the last image on the right is one of ungual or periungual fibromas, which are fibrous growth seen in the nail beds. Okay, so just to quickly go over the diagnostic criteria, there's 2 different criteria, the genetic criteria as well as the clinical criteria. So in order to meet the genetic criteria, you need to have either a TSC1 or TSC2 pathogenic mutation. And the clinical criteria, there are both major and minor features. In order to have a definite diagnosis of TSC, you need to have at least 2 major features or 1 major and 2 minor. So I'm going to go over it briefly, but aside from the 4 skin manifestations that I already discussed, the other clinical criteria for under the major features include CNS lesions such as cortical dysplasias, subependymal nodules, subependymal giant cell astrocytomas. The kidney manifestations include renal angiomyolipomas. The heart is cardiac rhabdomyoma, and in the eyes you can have multiple retinal hamartomas. And with the lungs, you can have lymphangioliomyomatosis. The minor features include some other skin findings, such as the confetti skin lesions. You can have oral lesions, dental enamel pits, intraoral fibromas, other eye lesions, including the retinal achromic patch, and renal cysts, as well as non-renal hamartomas. So now I'm going to transition to talk about our center. So in 2014, we received approval from the Tuberous Sclerosis Alliance for a TSC-approved clinic, and in April of 2014 is when we actually started seeing patients in our center. We meet in the Children's Hospital on the fourth floor, and the clinic is held the first Tuesday of the month, and it's generally the morning session. So this picture, or this slide, is not meant to be read, but just to show you that, as we know, TS involves multiple organ systems and requires multidisciplinary care involving many different people at our institution, and these are all people who are actively involved in our center. So I'm going to highlight on our clinic visits since April of 2014 for the tuberous sclerosis population. Up until now, we've had 18 new visits for new diagnosis of TSC, 106 follow-up visits, and just to clarify, that includes patients who were seen by other providers before they were transitioned over to our center. So they may have had an initial visit with other providers outside of the center, but then were transferred over for further management in our center. So that's a total of 124 visits since our clinic started, which is about 2.5 years ago. In terms of number of patients, we have about 41 TSC patients. This is only in the pediatric population. Just recently, we opened the center up to include adults, but we have not had any adult patients just yet, so we're hoping that this number will increase significantly. In general, our patients come see us twice a year unless they have a medical condition that warrants them to be seen more frequently. So patients who have difficult to control seizures, we often see them more often than just twice a year. And we serve the Bronx, Upper Manhattan, Lower Westchester, and we've actually even had patients come to us from further north, including Poughkeepsie and Binghamton. So at each visit, we do a routine neurological evaluation, and we also screen for any psychiatric conditions. If they have epilepsy, we obviously manage their epilepsy and adjust medications as need be. We assess all other organ involvement, and if there is a need for them to see other subspecialists for the other manifestations, we do have them meet with the other physicians. Each of the patients will also have imaging studies as part of their surveillance, in particular MRI of the brain and abdomen. So at each visit, we make sure that they've had an image recently, and if not, they get one anywhere from 1 to 3 years, and we review all of the imaging studies as well at each visit. All patients, of course, get a thorough neurological exam, and we also do a thorough skin exam to make sure that there aren't any new changes or any new concerns. And at each visit, we spend quite some time with the families to go over any concerns that they may have and provide guidance and education about tuberous sclerosis. We also provide resources for all of our families on tuberous sclerosis, especially with the TS Alliance website, as that has been a great source for a lot of our families. So this slide is not meant to be read as well. I just wanted to again highlight that patients with TS require extensive surveillance and management, and that at each visit we carry out the surveillance as recommended by the TS Alliance. So each organ system has a specific surveillance and recommendation for patients with TS. The central nervous system, eyes, teeth, and skin, the heart, kidney, lungs, and genetics. So I'm going to end here with a picture from our first event through the Neurocutaneous Center. We actually had an event at the Yankee Stadium where we got to see a Yankee game, and I don't remember the results of the game, but I think we won. And just prior to the game, we actually had all of our families meet other families with rare conditions and discuss what it's like to have a family member with a rare disease. So I'll stop there and take any questions.
Are there questions? I'm going to ask one. Isabelle first.
You don't mention autism on your list. Scandalous.
I think I did, but I will tell. Yes, I did.
Sorry.
That's okay.
But you didn't emphasize it. From my viewpoint, it's an important manifestation of TS.
Completely agree. I will definitely emphasize it.
Other questions? Fatema, so you're collecting clinical data. Is this being as part of a natural history study for tuberous sclerosis. And, you know, relative to, we're going to hear about therapy approaches later on. I mean, what's the sort of background on all of that?
So we are collecting data. We are trying to have, again, just as you mentioned, a natural history of our patient population, as we do have a special patient population in the Bronx here. So we're hoping to publish some information about what our specific patient population is like. And in terms of the management, I'm not sure I understood.
But I'm just wondering, you know, there are therapy approaches now for TS, and I'm just wondering whether, you know, the data you're collecting relative to your patient population and treatment approaches, whether that's, I mean, is it being aligned with data coming from other centers, for example, and through the TS Alliance, or are you more isolated, I guess is.
So no, I think we're doing similar things that other centers are doing. I think in particular, you're probably asking about the mTOR inhibitors. So we are using that here as well. We just, in terms of numbers, we don't have as high a number of patients on mTOR inhibitors as of yet, and I think that's partly due to our patient population and their concerns about being on medication for an extended period of time. When it's difficult for them to get to our appointments sometimes. But we are doing what all the other centers are doing as well.
Yeah.